I am much passionate about cardiodiabetes medicine, and I am proposing it to become a subspecialty of medicine. Now the agenda given to me is a home care or a non-doctor care or a community health workers in diabetes detection, prevention, as well as control. Because all the three are an issue in our country. We know this is the number. We are on 31 million here. We are the leader in the world. And these are the basic issues of diabetes. Why we want to propose an alternate system. The number of cases are more. There is shortfall of doctors and nurses, and many cases are detected, many cases are not detected. Many cases are controlled, many are not controlled, and an increased mortality and morbidity. We have been now listening serially how diabetes increases the cardiovascular mortality in a human. Why this malady? Patients not reaching to doctors, no follow-up. Therefore, probably we need another system to reach to patients, and public health workers may be the opportunity. Who are the community health workers? They are the frontline public health workers who bridge between the underserved communities and then the healthcare system. They are from, or they have a close understanding of the community with which they are going to work. And there is a entity called as Community Preventive Service Task Force, which is there in developed nations, which recommends intervention that engage community health workers to help patients manage their diabetes. And there are any number of studies which we will be sharing, wherein when an intermediate health worker has been engaged in controlling, and that has improved the glycemic as well as hypertension and lipid control of the citizen. And moreover, they are cost effective also. Sorry. And there are any number of names available depending on which country you are there. Can be a community health specialist or advisor, worker, navigator, and there is a promoter, D-Salute, which is a very, historical, entity. Community health workers are already engaged in maternity and child health. That is about 38% they do that. Tuberculosis, malaria, respiratory infections, and HIV. They are only vacant only in 15%. Only in this 15%, we have to utilize their services, or we will have to change the agenda. This intervention always, this include, it is a process. It's not simply putting somebody to the society to take care of the diabetic people. No, it includes an education, coaching, social support to improve the diabetic testing and monitoring. There is a system or a curriculum upon which these people have to be trained. And how they do that is they do a screening and a health education. They have an outreach, enrollment, and information. More important is they are locally, culturally, they are similar to the citizen. They are able to navigate and community organizers. And there are a lot of studies which shows that the HbA1c has fallen below 7%. Even in normally when they are on a hospital care, and it is not happening, probably it may be due to the lifestyle changes which Professor Manchanta was talking to us very recently now. Now the role of community health workers is that there are barriers to optimal diabetics management which are very much complex, and the most important thing is poor access to care, to lack of culturally tailored approaches. These community health workers typically work in their own communities, share cultural, economic, linguistic, and other categories, and therefore they establish a good relations with the patients, and they are able to influence them. They also serve as a good link between the health services and community. One side, we doctors and health services are there. Another side, there is a patient. They become an excellent link between them. There is a growing body of evidence supporting them. Their roles are mainly 5. There is patient care, education, support care, and care coordination and social support. There are any number of strong study designs which we will see that. These are again in the prevention and diabetes management. They are able to give a cost-effective control. These are the 10 core roles that the community health worker can play. As we said, cultural mediation, providing culturally appropriate health education, care coordination management, coaching, social support, advocacy, building individual community capacity, providing direct services, implementing an assessment, and conducting outreach. More important for we clinicians is they participate in evaluation and research programs also. These are the various roles, which are played by, the community, health workers, which have been assessed in the type 2 diabetes, study. That is a self-management practice. There are about 15 components they play: physical activity, and then random blood sugar, body weight, medication adherence. Like that, there are 15, components they are able to evaluate. And what I would like to stress from here is a community worker being displayed for the control and monitoring of blood sugar is a scientific, process. There are the various numbers. A little more expansion is there. For want of time, I may go a little fast here. First is a cultural mediation. They have a lot of sub-roles, and they have examples in relation to diabetes, because they can play a role in the total NCD, in hypertension, in obesity, in cardiovascular, all these things. And there are non-health referrals also, and advocacy is there, and building the capacity. Finally, they evaluate and submit the report to us. There are any number of studies in the high-income group countries, whereas now reports have started coming from low and middle-income countries. The conclusion from these studies, which are published in 2018, are they have several roles in the T2DM, and they have a better outcome. And there is, there are a lot of community health workers play in primary care also, which is highly effective, and the financial barriers also being overcome. There is a process called as a community-based participatory research approach. There are a lot of studies. The Reach Detroit Community partnership in 2011. In underserved Latino and African American patients with type 2 diabetes, they improved the HbA1c level from 8.6 to 7.8. Any number of studies are available now. There is a team-based approach. The team starts from the healthcare and it ends in the community through the community health worker, or CHW. And there is another study for the prevention of diabetes in the diabetes prevention in low and middle income countries. It has also confirmed the community health workers play a key role in the prevention of management of T2DM. This is a ADA study. Here the peer educators and professionals, when they do it is from through Bangladesh, and the capacity building by the peer educator is definitely more than we doctors build it on the patients. And there is another study which says when the community health workers are involved, the blood sugar level comes down, and the HbA1c also comes down, and when they are not under their control, it is going too high. We have, and there is a ADA study, a dial-based trial, which has proved when community health workers are there, the levels of HbA1c are very low, and when in the control study, when they are directly under the healthcare institution, it is not well controlled. We also did we have some rural clinics through our hospital, wherein they are always the community health workers go there, and they do a blood sugar and report to us. And in the control group and the intervention group shows an excellent blood sugar reduction, and the HbA1c also is very much reduced. We have data from the high-income countries, low-income countries, and the peripheral city. And as Dr. Manchanda was just now talking, the yoga program in our Bangalore city, which was taken to the citizen through the community health workers, proved very much useful. It is in the primary care. The ASHAs in our rural areas, that is social workers, are an important tool for the diabetes care, which has been published. And the current literature literature appreciates their role and positively they want us to engage. But only doubt they have raised is sustainability of their work. Since they have got multiple agenda as a national health agenda, sustainability of their work very important. Now this is a recent advance. All of us know that it control of diabetes through technology. This technology, instead of the hospitals taking it, when it is handed over to the healthcare, community healthcare workers, like control of the blood sugar, BP, diet, physical activity, even drug reminders, they can very well, be followed. This is the usual system, for the, control of hypertension and diabetes in rural India. It's an important study which has been initiated by the, government of India. Conclusion is through this health method, the control of the NCD are very much easier. They can, earlier they used to use, the mobile phones for, sending an SMS, and now recently even up to the retina, they can be engaged in a rural health van and they can take the pictures and they can pass it on to the base hospital. Any number of sensors are available which can transfer the, the parameters to the base hospital. Very useful for people who are in the solo care, elderly citizen in the solo care. They can be, trained to use a smart card which is coming up well, will be available throughout the nation soon. Through that, we will be able to evaluate the patient's condition. In our Tamil Nadu health,
1 minute left.
Our Honorable Health Minister has initiated a movement, health reaching to the home. The conclusions are a community health workers are a widely recognized tool for the improvement of diabetes and self-management outcome. Sustainability we will have to see, and we will have to train them adequately so that the care they offer are, uniform. Now the recommendations are community health worker is a valuable tool in the detection, control and prevention. A structured education of them is needed with adequate training. They must be linked with a smart health app, and physical visit can be interpositioned. And further studies are needed in developing nations. Diabetic, this epidemic needs them very much. Thank you all very much for your patient listening.
We had a legend person delivering this lecture. I will not ask question. One can have comments of the other doctors if anybody wants.
Sir, you have talked on a very important topic, Professor Arulrhaj. How do you think it can be implemented? How there is a big gap, we know, between what we tell the patient in the OPD, what is done at home, and that is why the results are not consistent. Now, in between, there is this person, the community health worker, who is from the same community, and he knows their language, their cultural issues, and these now in West are trained by the doctors. Do you think this is an option that at least medical college hospitals and corporate hospitals should take up these, take them upon wages and get employed, these people?
Yeah, this is very important. Now the government of India has already started it. If you remember, our Honorable Prime Minister has started some wellness clinics. They are spending more money to wellness clinics than, our health infra, which you have been now discussing. Now they have changed it. In these places, they are placing the Ayush doctors in this position. The position of a community health worker or an ASHA, they are putting it. Again, we have responded to the Ministry of Health and Government of India that the ASHA community health workers who are totally trained and they are working under the command of a qualified physician or an MBBS doctor linked to the base hospital, which can be a government institution, can be a PHC or a CHC or a district quarters hospital or a medical college hospital or a private hospital, should be linked by a digital technology. Then only the same allopathic line of management will come. Otherwise, if you put in an Ayush shop there, again there will be a total chaos and confusion. Sure, the government will definitely take it up, and professional bodies like API can also do that. When I was in chair, we linked with WHO. WHO I mean, international and WHO CRO for our nation. I mean, they wanted us to take up this control of NCD, both diabetes and hypertension. We have created an app. We are just waiting for the clearance, which can be, I mean, done through our, API members, through their staff, who can be placed in the, actually we suggested, there was a question that a lot of salary has to be paid. We suggested you get a lot of staff from rural areas. I mean, one of them, you have a catchment area for you. Those who are staff who are coming from those areas can be employed, and API members have accepted. Soon we will see the light.
Thank you, sir. Thank you for your valuable comments.